Well, UW Health is celebrating the 100th anniversary of its children's hospital.
The original hospital opened in 1920. The buildings and names have changed over the past century, but the commitment to care has not. I sat down with Dr. Ellen Wald, the chair of the Department of Pediatrics, and Barbara Byrne, vice president at American Family Children's Hospital, to talk about what a children's hospital has meant to Madison.
When I think about where we came from and where we are today, it's amazing to me, and the amount of community support that we have received in order to put this together over the years is incredible.
Yeah, it takes a village.
It does take a village.
Ellen, how about you? Do you get a little, do the hair on your neck stand up every time you come in here?
Oh, you know, when I came out, I was just in the old hospital for 1 year, but yes, 100%. I mean, this facility is so beautiful. I always am just a little bit regretful that I can't claim any credit for planning it, you know, because I think the people who did plan it did a fabulous job, really listened carefully to the patients and families, because it's a really super family-friendly place, and the staff loves to work here too.
Barb, what do you think this place means to our community?
This, I get a little choked up actually to talk about this, because I feel like the Children's Hospital is a gem. We have the best providers here, the researchers here, and the best nursing staff and support staff in the state. And for me, I feel like this building gives families hope. We see children that have very challenging diagnoses, and whether it be illness or a trauma, and we are able to provide excellent care to those patients and families, and where maybe there wasn't hope before, we're able to give them that hope because of the treatment and therapies and support that we give our families. So I see it as a healing place, and one that helps our patients and families have that sense of hope and for the future.
Ellen, how would you articulate that? You're on the front lines of this.
Yeah, well, I agree. I mean, I think I really feel very proud of the hospital. I think, you know, when I came, there were certain things that we didn't do so well, or we didn't do everything, and now we really do everything. And so there's no reason ever to say that a patient should go elsewhere, because we do it, and I think we do it as best as it can be done, and I really feel proud of that.
And just to see how far in your specialty alone pediatrics has come over the last 100 years. I was reading about how preemies that were born would not have survived, and today babies are born at a pound, and
yeah.
I mean, that's got to be remarkable in the trajectory of your career to see how far it's come.
Yeah, you know, one of the things, just in sort of reflecting on the history of medicine really over the last 100 years, which was how long we've been here, and really over the last 50 years in which I think so many advancements have been made. You know, when President Kennedy's young son Patrick was born, I don't know if everybody remembers Patrick, that was what, 1963? He was only 3 weeks premature. He was 37 weeks, and of course he had bad respiratory distress syndrome, which sometimes happens in a more mature premature. But there was nothing to do for that baby, you know, and that baby would never have died today, never. You know, now we have babies who are 12 and 14 weeks premature, and they get surfactant, and they don't even get on a ventilator, and they leave a few months later, and they're healthy babies.
It's incredible.
Yeah.
And when you think of some of the big specialties, cancer, transplant, it's all right here. The UW is one of the leading facilities in the country now.
And I think that goes to the point of the researchers that we have that are also physicians. And so they really are taking from bench to bedside. And, you know, we are doing novel therapies here that are done at just a few select organizations throughout the United States. So,
yeah, I always say, you know, God forbid if you get sick, you'll be thankful you live in Madison, Wisconsin. There's really not much of a need anymore to go to Mayo or to anywhere else. It's all right here.
Right.
And especially for children.
Right.
Sometimes parents or the lay public doesn't really understand until there's an injury, you know, cancer diagnosis, congenital heart disease, then all of a sudden people see how important it is to have this very specialized care.
And you'll see it for yourself in just a little while. There's more to come on this story. The American Family Children's Hospital, we were sitting in the lobby there, officially opened in 2007. We'll go inside and we'll take you on a tour of this world-class facility. That's coming up after Dana's weather. And we'll be right back.